Hi, this is Dr. Sargent at Sargent Plastic Surgery, and today we're going to talk a little bit about facelifts. Facelift is essentially an operation designed for the lower face to get rid of the excess skin and tighten that tissue underneath that. And so it's rejuvenating the lower face, which means we're setting the clock back. We may set the clock back 10 or 15 years, so you'll always look younger than if you hadn't had it done. Now, there are different types of facelifts, and that can be confusing to patients, so I get a lot of questions about that. One type is a skin lift. Skin lift means just tightening of the skin. You just go underneath the skin, you pull on the skin and take off the excess. The problem with that operation is that it puts too much tension on the skin stretches, the scars can widen, it's not a long-lasting result, it tends to look pulled, and so it's not an operation that I do. The other operations are different variations of tightening the underlying tissue, which I think anybody who does facelifts and has a lot of experience knows that you have to tighten the different layers underneath the skin to get a better long-lasting result. And so one type is a smash facelift, which is just a superficial musculoabnorrheic system, which just means it's a layer of tissue that can be tightened. Another, which is confusing on the internet, it's called deep plane. There are different varieties of that, but you're tightening different layers that are deeper. And I think those are all important to tighten when you're doing the patient, but it's important to individualize that so you do the best operation for the patient's particular problems. Now, the neck area is usually one of the patient's most important concerns, and so you're going to remove all the fat and you're going to tighten that muscle really tight to create a very good jawline and neckline. So that's important in facelifts.